early 2024, there were some warning signs in the Massachusetts healthcare system. By May, we knew that Steward Health Care, which managed 8 community health centers in the state, was in trouble. Bankruptcy-level trouble. Those proceedings sent the state into a tailspin over the consequences of allowing private equity into key healthcare services. And here we are now with most of the Steward hospitals saved, but 2 allowed to close. So, how are those communities holding up more than a year later? I'm Jennifer Smith, and this is the Codcast, CommonWealth Beacon's podcast about policy and civic life here in Massachusetts. Today, I am joined by Hallie Claflin, my colleague here at CommonWealth Beacon, who took a deep dive into the repercussions for Nashoba Valley and the area of Dorchester now left without their central healthcare service. Let's talk about it. Hallie, thanks for being here.
Thanks for having me, Jen.
So let's start out with the basic grounding that in case you are someone who is either new to Massachusetts or hasn't been following the mechanics of the Steward Health Care bankruptcy proceeding, how did we get here? What is Steward Health Care? Why are there now 2 fewer hospitals?
Absolutely. So it is a chaotic mess, to
Politely
put it very
it.
bluntly. Well, Steward Health Care was, a huge hospital network, not just in Massachusetts, but throughout the entire country. So Steward operated 8 hospitals here in the state, but there were many other hospitals across the country that were affected by this. And its bankruptcy was essentially a financial mismanagement scandal that was really widely covered, not just by outlets like the Boston Globe, but all sorts of national outlets. It gained a lot of attention, and it was sort of the demise of the country's largest for-profit, one of the country's largest for-profit hospital chains. So like I said, Steward operated 8 of those facilities, and along the bankruptcy process, the state sort of came in and set forth in motion this plan to sort of save 5 of them, which is what it ultimately ended up being. One of those hospitals, Norwood Hospital, had sort of been closed since 2020 due to flooding, but the other 2, Kearney Hospital and Nashoba Valley Medical Center, were really sort of left behind, which I think a lot of people have questions about, because why is it that we could save 5? And that term save isn't like a term I'm using. It's the term that the governor uses. She says, my administration saved 5 of these hospitals. So I think a lot of people have questions about, like, what does that mean? What did the state do to save 5? And why did it have the ability to save 5, but the other 2 were really just kind of out of their hands?
So these communities that we're talking about here are very different in nature. So we are dealing with a neighborhood in Boston, Dorchester, which is the largest and most diverse neighborhood of Boston, and a specific village inside of that neighborhood, which now no longer has the Kearney. And then we're also dealing with a pretty large region of Massachusetts that is now without this hospital, Nashoba Valley, and it's not just the community of Ayer that's dealing with those consequences. So kind of lay the groundwork for me here in terms of the literal groundwork. Where are we anchoring ourselves a year later? Why were you focused on kind of these regions? And what did you learn about the characteristics of the people who were served by these hospitals?
Yeah, so it's very true that the neighborhood of Dorchester and the rural town of Ayer are very different. So Ayer is in north central Massachusetts and part of the Nashoba Valley region. So it's really important to think about this not as, a hospital closure for just Ayer. This was a hospital closure for a collection of around 17 different small municipalities that are in that Nashoba Valley region. So taking away that hospital didn't just affect Ayer. It affected surrounding cities and towns like Leominster. It affected much smaller towns like Shirley and Groton and Pepperell that really relied on Nashoba Valley Medical Center. And it's a lot. I think the effects of a hospital closure are felt really severely, especially being in a rural area where there are so few other options for not just emergency care, but just so few hospital options and specialty care options around in that area. But in Dorchester, I do think that there was this sort of narrative maybe talked about amongst the community or maybe outside the community that, a hospital closure in Boston, big whoop. There's millions of clinics and community health centers and hospitals all across Boston. You can just simply go downtown and get to another hospital. You can just simply get your care somewhere else. And it really is not that simple. And I think I was really able to sort of shed some light on that just in my discussions with Dorchester residents and community activists and people who really, lived close to this hospital and had that access, which is arguably the kind of access that a community hospital should provide to, a neighborhood or wherever you are. So very different areas, but I think Dorchester and Ayer actually are similar in one way, and that is that, the Hallie administration, the state, the health department has consistently recognized these two communities as having some of the worst health outcomes in the entire state of Massachusetts. So that is where they're sort of similar in this, and they have that shared sense of, hey, things were really bad before this, and now, without a community hospital, things are getting worse. And so they sort of share that struggle.
So I'm glad you brought up kind of the distance and the difficulty sometimes in physically reaching this kind of care, because part of the reason that we're talking about this is it was one of the stories that we did for a healthcare-focused month, and the first story that I had done for that month was about literally who can physically access hospitals, and the metric that the state uses for this is, are you inside half an hour of driving? And one thing that makes that very strange when you think about it for half a second about the Boston region is we have so many hospitals here, as you note, but we also have pretty decent public transit. So the idea that, well, you might be able to drive somewhere inside half an hour, but what if you got used to walking to your local hospital and suddenly it's not there? What if you got used to taking the T to the local hospital and now that'll take you an additional 45 minutes if you have to take 2 transfers to your other one? So talk to me a bit, as you were sort of diving into the Dorchester part of it, what it was like for the people that you talked to who used to be able to walk a few blocks to get their needed care now that that's no longer available.
Yeah, and I think it's important to point out, too, in Dorchester and in any city, a lot of people really lack cars. And so, relying on public transit to maybe get somewhere, get to an ER, get to a specialist, especially in those more emergency situations, is really not always feasible. And also, you have the city of Boston, which has a really lovely traffic scene. Getting to a downtown hospital from Dorchester, although it might not seem very far, in any given rush hour day or just any day in general, running through that traffic, again, especially if you have an urgent need or an emergency, again, it's not as feasible as some people like to think it is. But yeah, one particular woman in source I spoke to, she's a resident of Dorchester. Her name's Jane McInerney. She was really able to shed light on this. She's a 69-year-old resident. She's wheelchair bound. She has multiple sclerosis and, actually moved to Dorchester because of the very close access and quality care that she received at Kearney Hospital. She lives just a few blocks from the Kearney, and really having that sort of access for someone like her is huge, because now that the hospital is closed, she's getting her care at so many different clinics and hospitals that are all throughout the greater Boston region, which not only is adding this travel barrier for someone where that travel is very hard for her. She has to schedule rides, and she has to schedule transportation and car rides in advance now that are offered by her insurance. And I think she can sort of see where this is going. She told me, I think that I'm probably just going to start going to the doctor less. She was able to eventually get set up with all those providers, although it took an entire year to finally get it set up with them. But to have someone who, is now being seen at so many different places all across greater Boston, it's this huge barrier. And I think that we know from research and experts, especially older adults, are more likely to have been in a long-standing relationship with one doctor or one provider at one hospital. They struggle more often to find primary care physicians. They struggle to find specialists, and transportation and travel is a barrier to them. But we also know that, especially for older adults and disabled adults, delaying access to care delaying care, receiving any kind of care at all is really detrimental and sometimes life-threatening for them. And so for people like Jane, she's really feeling the effects of this, not just because she's, lived a few blocks from Kearney, but just, the state that she's in, she understands that this is the outlook for her. She's probably going to go to the doctor less, which isn't good.
And so what was kind of the timeline here? How did the closure actually kind of affect Jane as it was happening? Because we saw that this bankruptcy was going to be occurring. There was a question about whether or not the state was going to be able to intervene to find other buyers, other operators. Was she hoping that there would be a solution for the Kearney? And did she talk about when that hope sort of died and she just had to figure out what this new reality looked like?
Yeah, she definitely talked about that. She talked about, maybe having hope that the state would step in here. And I think a lot of people in the Dorchester region, even community activists, even had that hope a little bit that maybe the state could nudge Boston Medical Center into acquiring the property, if they offered the right kind of funding for them to meet their bids on that hospital. And Jane really had hope, I think. And I think once that hospital closed its doors and actually shuttered and, put up the sign, hospital closed, here's your nearest hospital, I think that's when she sort of lost a little bit of that hope and really started to realize, because she requires a lot of specialist care and she requires a lot of sort of frequent care. And so I don't think there was any time to wait or to waste for her. But she did mention, there were a number of providers and specialists that she couldn't get set up with for almost an entire year. The Codman Square Community Health Center in Dorchester has like a 5-month waiting period for new primary care patients. And that would have been the nearest clinic and community health center to her. That would have been a great option. But I think what we're seeing is these issues and these cracks that already existed prior to the closures then became just wide gaping holes once the hospital was taken away, because I think that Boston emergency room volume was already at an all-time high. I think wait times for primary care already a huge issue. So to take away this hospital, it's Kearney saw around 30,000 annual emergency department visits a year. And so looking at that, it's that had to be absorbed somewhere, and it was absorbed somewhere. And so you have really overrun emergency departments. You have the Boston EMS has seen a 20% increase in transport times. And so it's really been absorbed, but not always in a great way. And I think Jane is someone that feels the effects of that. Someone who used to be able to get herself to her doctor's appointments just a couple blocks over to the Kearney is now something that's a lot more challenging for her.
Yeah, this actually reminds me, for listeners who may or may not recall or want to go back, we did an episode a little while ago about kind of the labor perspective of the primary care crisis and the hospital crunch. And one of the people that I was talking to was a worker at one of the other Boston facilities who was saying, yep, we have literally seen our caseloads go up specifically because of the Kearney. For those areas right around it, if they were able to, absorb that. I think let's kind of move ourselves now over to Ayer, where, again, it's not a matter of just if you are close by, if you need very specialized care, this is the best oriented place for you. But if you were anywhere in the Nashoba Valley region, this was your center. So walk me through what it looked like before, if maybe someone in a neighboring town needed care, and what they're doing now.
Yeah, absolutely. I think in Ayer, the situation is different, but also a little bit similar, just in the sense that, the closure really exacerbated issues that were already there prior to the closure. And so I think the biggest strain on the Nashoba Valley region from this closure has really been on the EMS services. So when you think about it, these are really small towns, and they're not rich towns, as Ayer town manager Robert Pontbriand put it. They're not rich towns, and so you have firefighter EMTs, you have EMS staff that you don't even have enough staff in Ayer to operate 3 vehicles at a time. You have 2 ambulances and a paramedic truck that you can only operate 2 at a time. And when you think about transporting someone via ambulance to Nashoba Valley Medical Center might have previously took not but 15 minutes. And now you're having to transport them to Emerson Hospital in Concord or UMass Memorial Health Alliance Leominster campus down in Leominster. That is actually it might not seem that far, but that's a significant undertaking because now total transport times for those ambulances are ranging anywhere from 1, 2, 3 hours, where it used to be maybe under an hour or under an hour and a half. And so I think that the biggest thing for EMS staff there is like, if anything else happens in the town of Ayer,
there is no ambulance.
There is no ambulance. That ambulance is out for a good 2 hours now, going all the way to, whatever the nearest hospital is or whatever the nearest emergency room is. And I think just with the lack of staffing and resources that they already had, that's such a huge problem because they were already struggling and now their transport times are so much longer. And I think all those communities are really feeling it. I talked to the fire chief in Ayer who mentioned all of these towns now rely on mutual aid. So they're constantly calling in staff and EMTs from Shirley or Groton or Pepperell, whatever the town is, to try to help address, if all of Ayer's ambulances are out on a call of someone who had a heart attack and there's a fire in Ayer, now they need mutual aid to come from another town. And so that has been so difficult for them because we're not talking about, it's 2 miles away. We're talking about a 40-minute drive to Emerson Hospital if you live in Pepperell.
And so how is the staff feeling here? You were out there, this is, an empty building, and there are people who used to work in it who are now kind of at loose ends.
Yeah. It's really personal for them, I think. Speaking to Audra Sprague, she was a ER nurse at Nashoba Valley Medical Center for 17 years. She told me, I think about this all the time. I think about, where are people going? Where were they absorbed? Are they getting care? Are they not getting care? Are they not going to the emergency room because it's 40 minutes away? Are they not going to see a specialist because they couldn't get in somewhere else to be seen? It's very personal to her, and I think that working at Nashoba Valley, she saw on a daily basis how important it was to have a community hospital, how important it was to have a hospital that's 15 minutes away if someone's having a heart attack. And I think she knows the really perilous repercussions of then having to transport someone who's having a stroke or a life-threatening emergency 40 minutes to Emerson or 40 minutes to Leominster. And that's not even taking into account the wait times and the increased volume at these emergency departments. Leominster, part of UMass Memorial Health, has seen just incredible ER and emergency room overcrowding in the last year. The daily census has risen far above the beds that they have. And I also spoke to the ER secretary at Leominster ER, who used to work at Nashoba. And, she said, we're in a constant state of code help. And a code help policy is just sort of this plan that the state requires of every hospital. It's sort of a surge plan. So, what to do to bring in staffing when emergency rooms are incredibly overcrowded. But she said being in a code help now is kind of just the norm. She said it doesn't amount to much but words. Being in a code help is just kind of what we always are. And she said, I see patients waiting 6 to 8 hours. That's the average wait time at all of UMass Memorial's Health Alliance campuses. So it's really challenging. And, the fire chief from Ayer also mentioned that, too, is like in one weekend now in August, they transported people to 7 different hospitals in the region. And that might have looked a lot different before. It might have looked at, 7 different transports that all went to Nashoba Valley, which was much closer. So now they're going every which way. EMS staff is incredibly tired. And local leaders have huge concerns about that, about losing more staff than they have already lost. And so it's been really challenging for them. And I think we see, too, just with incredible wait times, people waiting to be not just treated, but people waiting to get diagnosed with whatever they need to get diagnosed with to then be transferred to another hospital, go on life flight. Are they having a heart attack? They can't really come to those conclusions because they're waiting so long in the ER. And so this has just really exacerbated issues that were already there, but they're definitely feeling it.
And I mean, I have to kind of put a point on this. How is that squaring with one of the rationales around allowing these two hospitals to close, which is the demand allegedly not being there in the same way that it was in other regions? We've seen, for instance, that argument come up in areas like North Adams, all the way on the other side of the state, where they had to get special kind of categorization as a critical access hospital because the argument was you can't operate like a normal hospital because you don't have enough people coming in. But if you're in a rural region, you're kind of there to serve a smaller population that still needs care, right?
Right. I think a lot of the residents and hospital staff that I spoke to kind of expressed this sentiment of like, yes, maybe our patient volume had decreased over the last decade, as it has in most hospitals and clinics around Massachusetts. But having that declining patient volume still doesn't mean that that community hospital wasn't essential to the surrounding towns and community that it was serving. And I think one of the things during the Steward bankruptcy that was really sort of caused a lot of confusion for people was that Steward wasn't great at tracking this kind of data or reporting it. And I think during the bankruptcy process, they were reporting average daily census numbers. And those average daily census numbers don't include outpatient surgeries. They don't include patients who are only there receiving medical imaging services, so x-rays, CT scans. It doesn't include ER patients who were transferred or who were not admitted. So it's
numbers, a pretty substantial undercount.
Right. Those numbers aren't quite accurate. And another thing that's really important to remember here is that we know that for months and months leading up to the closures and the bankruptcy, Steward had been pulling staffing and resources at these hospitals in attempts to cost cut. And so a lot of these hospitals, especially Nashoba Valley Medical Center, they were transferring all their patients because they just simply didn't have the staff or the resources. That doesn't necessarily mean that patients weren't coming to that hospital. That doesn't mean that that hospital just, were empty and had no patients. They had no other choice but to direct those patients elsewhere. So I think a lot of the, mistrust around this whole bankruptcy process and the betrayal sort of comes from things like that, where the numbers were getting really misconstrued. And I don't think we'll ever really know what the true volume in those hospitals was. But like I said, Kearney would see around 30,000 annual emergency department visits. I mean, that's huge. And it's huge when you think about where else this has to be absorbed.
I think getting to the idea of that mistrust. So part of the reason that we're talking about this, and you started this article pretty close to a year after both of these closures occurred, what have these communities kind of been trying to do since then? And what have they learned about the way that the state approaches this kind of need?
One of the things I was most struck by when I was out reporting in these communities and hearing from residents and hospital staff is just how betrayed and sort of helpless they feel in the whole entire process of how a hospital closure happens. I had community activists in Dorchester who said, anytime there's a hospital closure, there's usually a public hearing, and he remembers a lot of those residents showing up and just feeling like this wasn't going to do anything. This was incredibly futile, and nothing they said or did, no matter how many times they hung up signs or voiced their concerns, nothing was going to stop this. And so it's this huge sense of betrayal. And I think the Hallie administration has a lot of unanswered questions when it comes to this. Like I said, a lot of people don't understand why 5 hospitals were saved and the other 2 weren't. And we know that Steward was sort of the one deciding if these bids were qualified. But I think the question remains of why couldn't the state have put forward funding beforehand to incentivize potential qualified bidders to then place bids on these hospitals? Why couldn't, another network or hospital provider be corralled into this if the state offered enough funding? Those are some of the questions we don't have answered yet. And so a lot of these residents just feel really hopeless, and they understand that, especially when private equity comes in and sort of eats up their community hospitals, they have no control over that, and they once relied maybe on the state to regulate that sort of thing and to step in. And I think they just see now that that's not what happens in this process. Even with the essential services closures, there usually is a time limit on when those need to happen. And both Nashoba Valley and Kearney were allowed to close far before that timeline. And so it happened suddenly. People had to find new providers very quickly. Doctors and nurses and physicians had to be recredentialed very quickly. It was really not handled well. And I think a lot of people have that sense of betrayal still.
And to kind of anchor us a little bit back in these communities, when you were walking around there, what did it look like? What did it feel like? Because again, these were major infrastructure projects. These are very visible. If you're anywhere around the Kearney, you can see the Kearney, Nashoba Valley, very central to the area. What does it feel like now when you were talking to people about the difference before and after?
Yeah, it feels really sort of desolate and abandoned, I think. I had Jane McInerney, again, Dorchester resident, take me to the Kearney site. The doors are shuttered, boards are up. They have, I think, some squatters around. She mentioned, there's sometimes kids in the neighborhood that are, sort of leaving trash around the area. And another community activist in Dorchester mentioned, like, walking by a community hospital that served you your entire life and seeing those boards up, it kind of feels like walking by a gaping hole, he said. So it's really sort of devastating for the communities. And same thing in Nashoba. Residents, hospital staff told me, driving by this shuttered hospital thinking, sort of having a false hope, thinking, oh, maybe the state will still do something, maybe the state will still come in here, maybe there will be another bidder, maybe there will be another hospital network that comes in and fixes this all and saves us all. That's sort of how they put it, is sort of saving us, because I think they're sort of drowning in, like I said, the issues in healthcare that already existed in these communities that were really exacerbated. They're really drowning in it. And these hospitals were vital to them, whether they had a declining patient volume or not. They were really vital to those people. And the Nashoba Valley Medical Center staff this year, on August 31st, on the 1-year anniversary of the closure, sort of had a former employee picnic in the parking lot of the hospital, to commemorate or commiserate, the loss of their hospital. And, they just mentioned sort of having fun being with the staff again, but not being able to forget why it is that they're there. And, now they're all, essentially working throughout the region, but they all see the effects of this, not just what it meant to lose a hospital in Ayer, but what that means for the surrounding communities and the strain that it puts on them.
And I think what we kind of want to end with here would be a bit of a look at where we stand now and where it might go going forward. My assumption is that the Nashoba Valley region is not just kind of like, I guess we don't have a hospital anymore. There are efforts to try and figure out how to boost services.
Yeah. So in Ayer, when it comes to Nashoba Valley Medical Center, UMass Memorial Health is going ahead with plans to start building I think, $42 million satellite ER facility, which is in Groton. So it's not directly in Ayer, but it is in a surrounding town in Groton. I think that local leaders have a little bit of skepticism around that, just in terms of all of UMass Memorial Health's sort of financial struggles in the last year or two. That's really an expensive undertaking. I don't think it has much state funding at all. And so that's an expensive project, and I think some leaders are a little cautiously optimistic about whether or not that will go through, but they are going ahead with those plans. So that will certainly help. It's not a hospital. It doesn't have inpatient beds, but it's definitely something, and it could hopefully alleviate some of the strain on EMS that's happening in that region. For Kearney, the outlook, I think, is a little more dismal. There are plans, and it's important to say plans here because these things haven't come to fruition yet. But Heim Investment Group has potentially signed a contract with Apollo Global Management, which is the property owner, to potentially start creating something on the Kearney site. We don't yet know what that is. Neither party has responded to requests for comment, so we don't quite know what those plans are. But it is really interesting because Mayor Michelle Wu has repeatedly said she will not let anything else be built on that Kearney site other than a hospital or a clinic or a healthcare component of some sort. She just won't allow it, and her administration, per the zoning, won't allow it. And so I think that for Heim Investment and the potential developers going forward, I think they know they can't really get away with anything but a healthcare component, but we still don't know what that looks like. Is that a full-blown hospital? Is that a clinic? Is that a community health center? Is that, assisted living apartments? Is that a nursing home? We don't quite know what that looks like. And, we're going to be watching to see, how the Wu administration takes any sort of development attempts there. So a little bit of hope, but again, nothing has really come to fruition yet, even though we're a year out, which is why I think it was really important to do this story, is to see what has developed and what has changed in the last year.
All right, well, you can read Hallie's very excellent, very long story on CommonWealthBeacon.org. We have talked about it for half an hour. I promise you there is even more stuff in there, so head on over, read that, refresh yourself on some of our Health Month coverage if you want to. Thank you again to Hallie for joining me on the Codcast. Thank you for listening. I'm Jennifer Smith. Our production and theme music is done by Charlie Cazella. Leave a rating and review wherever you're hearing this now if you want to help other people find us, and email codcast@commonwealthbeacon.org if you ever want to get in touch directly. We'll be back in your ears next week.